Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration.
Hi, I'm Judge Jodi Debbrecht Switalski of the Switalski Group. As a former Metro Detroit prosecutor, I had the opportunity to work on a myriad of felony violent cases, a lot of cases involving interpersonal violence and substance abuse. From there, I transitioned, having been appointed by the governor of Michigan to the bench in 2010, I transitioned into a treatment court judge. Having my background in substance abuse, both academically and even personally with my family history of addiction, all of this has really come into full circle, and that's what brings me before you today. So I wanted to talk about a couple of different experiences because there are some things that I don't think are very clear from my very boring bio, which can be pretty lengthy and extensive. Some things changed my life. Understand, I've already told you I come from a family that suffers from addiction. My grandfather died of complications related to cirrhosis. I have one uncle in recovery. I have another uncle in recovery, if you know what I mean. And my brother, who's 15 months older than I am, has gone in and out of bouts of long sobriety and recovery, and then to be followed by having to find that clean time again. So I really understand that. I've worked with hundreds of people in treatment courts suffering from addiction and substance abuse, and it all has left an impact on me, but none of it impacted me the way that Brendan did. Because you see, I had the opportunity to prosecute Brendan's parents, and I liked them. They were young, they were in their early 20s, they were trying to make ends meet. And let me tell you, they were going about it all the wrong way. Mom, after the delivery of her second child, she had a tough delivery. She was given a prescription for OxyContin very, very quickly. She moved into that physical dependency phase, probably abusing, taking massive quantities of the substance, and maybe even into addiction as well. What happened, however, is this, because we have to think about our children in this issue as well. Brendan and Braylon, two young boys, right? They're watching us. Kids learn through modeling behaviors. I did my master's in human development and family studies from the University of Missouri. Go Tigers, right? And think about how they eat. You take that spoon, you stick it in the baby food jar, you open your mouth, right? Because you want the child to open their mouth as well. When they do, you slip it in, and then what do? You make those ridiculous noises. So good, because you're reinforcing the behavior. Pretty soon they're picking up the spoon themselves. They're having some mistakes. They get it right. They have learned through modeling behaviors how to feed themselves. Well, that's just what these two boys learned from their mom, too. You see, what the older brother told us at exam is that mom would take the pills and they would make her happy. Opioids affect your dopamine receptor, create a euphoria. So when Brendan found the pills, that's just what he did. He took them. And the coroner testified that in about 20 seconds, he was in full cardiac arrest. You see, opioids and benzodiazepines, they shut down your central nervous system, your heart rate, your breathing. Fortunately or unfortunately, depending upon your disposition, Brendan was resuscitated. He spent about the next 8.5 months in Children's Hospital Detroit, where he's a crime scene at this point. His parents can't visit him. His family can't visit him. Only myself and the guardian ad litem, his attorney, could visit him, and that's just what I did. You see, every single month in this country, hundreds of thousands of people present to emergency rooms for overdoses. Many of those are opioid medications. About 40% of those presentations to the ER are accidental overdoses to children under the age of 6, just like Brendan. It changed my life because after the judge issued the order to withdraw Brendan's life support, it took him about 6.5 hours to die. He was the exact same age as my son. He was 18 months old and he died of a drug overdose. And here I am as a prosecutor and I'm wearing the white hat. I'm championing these causes for victims. And I had to ask myself, what had I done? What had I done to change this? And the answer was nothing. Why is this important to you? Because potentially your name could be on that bottle. I've got some notes with me today. There's some new data that has just been released. As we sit here right now in January of 2017, 91 people will die every single day from opioid overdoses in this country. Approximately 60% of those deaths are related to pain medications. Dentists, well, the Centers of Disease Control, before we even go there, have reported that healthcare providers, as recently as 2014, have written 259 million prescriptions for pain medications. Think about that. That's almost one bottle, one prescription for every single American adult. That's a lot of pills. Until last year, dentists ranked number 3 in the country. They've slid to number 5 behind internal medicine, primary care doctors, nurse practitioners, orthopedics, and then dentists come in for writing the most prescriptions in this country. Listen, we live in an age where there is not a single group that is immune from this addiction, where Vicodin is the drug of choice for 12 to 13-year-old kids. And 70% of the drugs that our kids get, they get them from a family member or from a family member's medicine cabinet. We must control access. There was a study recently. I want to make sure I don't get these facts confused. It was just recently released from the Journal of Drug and Alcohol Dependence. Their findings translated that there are over 1 million opioid pills prescribed to patients following the removal of wisdom teeth, and that those pills, oftentimes, the majority of those pills, go unused. 94% of patients were given a prescription for opioids following these tooth extractions, and 3.5 million young adults in this country are having their wisdom teeth removed every single year. Start doing the math on this. There are massive quantities of pills going out there. We are exposing our kids in their most vulnerable times, when their bodies are developing, their brains are developing, and we're imputing something that gives them a euphoria and a reward. They like it, and it doesn't kill them like we said it would. A 2012 study, it estimated that 61% of 14 to 17-year-olds received an opioid prescription following that third molar extraction. And again, as I said, this is often the first exposure that many American adolescents get to opioid medications. Listen, this is a serious problem. It is not one that we can keep our head in the sand about anymore, and that includes judges and the dental profession, pharmacists, doctors, all of us, parents, teachers, everyone can do something about this epidemic, because addiction to prescription opioids in the United States especially is clearly at epidemic proportions. They are silent no more. Overdoses now are the leading cause of accidental death in this country. Yes, in front of gun homicides, in front of motor vehicle accidents, the leading cause of death. And 60% of those deaths occur of patients who have been given a prescription according to prescribing guidelines by medical and dental boards. So they're using it the way that you've asked them to, and they're dying. Think about that dynamic. The country, like I said, is taking notice, but not just the country is taking notice. This is the litigator and me. The Drug Enforcement Agency is taking notice, and I would submit to you, even worse, so are the civil litigators, and they are coming to you, and you make an easy target. Do you know why you make an easy target? Quite honestly, you wear a white coat for a living, and that gives juries the idea that you have money. Plaintiffs' lawyers don't sue people that they don't perceive to have money. So what do you do? How do you protect yourself? How do you protect your practice? How do you protect your community? I'm going to give you the tools to do that right now. First thing that you do, the absolute first thing that you need to do, is take a thorough patient history. The National Safety Council reported that only 23% of medical and dental practices actually take a good family history of addiction. They ask the right questions. So there's a couple of indicators that you can screen for. One of the most important ones is age of first use. How old were you the first time that you used a substance, alcohol or drugs? Do you have a family history of addiction? Define addiction. How many of you can give a medical or a dental definition for addiction? When you ask people what is addiction or has anyone in your family suffered from addiction, how do they know what that means? Especially if you don't know what it means. And why would you? You're a dentist, you're not an addiction specialist. But it's important to educate ourselves and educate our patients as well. Run that prescription drug monitoring program, okay? Listen, I come from Missouri. My family still lives in Missouri. I'm a proud Missouri Tiger, right? Mizzou, for those of you in the audience that went to the University of Missouri in Columbia as well, right? We're the only state in the country that still doesn't have a prescription drug monitoring program. Some are good, some are bad. There's complaints about all of them. What does it do though? It shows that you're doing your due diligence. Educate your patient. Again, what an opportunity. Use informed consent documents and parental consent documents as well. They must understand what they're getting into. Develop a protocol. Never, never, never refill for lost or stolen opioids. Educate on proper storage and medication disposal. Listen, these solutions, simple solutions, can save a life, without a doubt. Take Paige, for example. She's a beautiful girl. She's smart, she's talented, she's from an intact family. Every single one of us would have been proud to have her as part of our family or have one of our sons or daughters be friends with her. She really possessed a light about her. In her late teens, she had her wisdom teeth removed. No one told her or her parents that they were addictive, the opioids that she was prescribed. No one monitored her, no one checked. Very, very quickly, physical dependency happened, okay? Not addiction, but where your body says, I have to have it. 4 out of 5 people who use heroin start with a prescription drug, typically from a medical practice, medical or dental. Paige was in my treatment court. We tried everything. I had a huge bag of tricks. On her second round of inpatient treatment, she left. She was picked up and she stood in my jury box on September 29th of 2014. I had no more tricks in my bag. I went up on the bench, my unflattering black dress, and I looked down on her and I said, Paige, I said, you're gonna die. I said, you're gonna die, Paige. I started to cry. She started to cry. I sentenced her to 90 days in the Oakland County Jail. Listen, if I could have given this kid 90 upon 90 upon 90, I absolutely would have for 2 reasons. 1, her parents could sleep at night. 2, she'd be alive. She was released slightly before Christmas with good time credit. Most people suffer an overdose within 2 weeks of being released from treatment or incarceration. Paige made it until March 30th. Of 2015, about 2 o'clock in the morning, I received a phone call and it went something like this. Judge, I'm sorry to wake you. I thought you'd want to know that Paige Mazurek is dead. She died of a drug overdose. I was inconsolable. I'm not a crier. I couldn't get myself together. And at some point in the morning, I was sitting on the floor, leaning back against the foot of my bed, and I was looking at the photograph of Paige, the same one that you can see. Beautiful, all American. My then 9-year-old daughter, Grace, came in. She says this to me, Mommy, why are you crying? She's like, why are you crying, Mommy? I explained to her what had happened. And she says, she doesn't look like a drug addict. Do you want to know what I had to tell my 9-year-old? Yes, she does. This is the face of drug addiction in our country. It is not someone else's child. Your name is on those bottles. We have to remember these are someone's children, and the addiction happens so very quickly. Make the changes. Protect yourself, protect your practice, protect your community, save a life. Do something. Thank you.